The diagnosis of periodontal disease and cavities are two important parts of a dental examination. Since you may have periodontal disease yet have none of the symptoms, we perform a thorough examination using X-rays and a periodontal probe to measure bone levels around the teeth. When the bone level falls, the gums pull away from the tooth, forming a pocket. We measure the depth of this pocket with a periodontal probe. The measurement is from the bottom of the pocket, where the gum is attached to the tooth, to the top of the gums. These are healthy gums. They're tight against the teeth, and there aren't any pockets. Now notice the difference with early periodontal disease. In general, the deeper the pockets, the greater the spread of periodontal disease. Bleeding is a sign of infection. Healthy gums don't bleed. In this case of moderate periodontal disease, we see the red and swollen infection of the gums. The stippling disappeared when the gums became swollen. Look especially close at the difference of the gums between the teeth. This is where periodontal disease usually starts. X-rays tell us a lot about periodontal disease. This is a healthy mouth. The bone comes up high around the necks of the teeth, and it's even throughout the mouth. This is advanced periodontal disease. The bone level is much lower. Notice how uneven the bone levels are compared with the healthy mouth. So now you know how we diagnose periodontal disease. Probe readings greater than 3 millimeters, bleeding upon probing, swollen and red gums, especially between the teeth, and bone loss or tartar on the X-rays. You also know what caused periodontal disease, the accumulation of plaque. The bacteria in plaque also produces acid. This acid destroys the enamel of your teeth and gives you cavities. Finding cavities is sometimes easy, but sometimes it's not. For hard-to-find cavities, we use a dental explorer and X-rays. We check the tops and sides of your teeth with a dental explorer. To look for cavities between teeth, we use X-rays. Metal fillings and crowns show up as bright white. Cavities show up as dark spots. These small dark spots on this X-ray are cavities. It's far better to catch and restore cavities while they're still small and in the enamel layer of the tooth. Once they're in the softer dentin layer, they really grow quickly. If they make it to the pulp chamber, we have a whole new set of problems and a different problem to discuss: root canals. The dental profession has assigned each tooth a number and every surface of a tooth a letter. If we find cavities in your teeth, you'll hear us name the numbers and letters for each one. Of course, what we all hope is that you keep all of the plaque off of your teeth, so you'll never need to know about these numbers and letters.